Hello, everyone. I'm Jennifer Piñate. Thanks for joining us for this COVID-19 update. We're waiting for Governor Asa Hutchinson and his team to give their daily briefing on the spread of COVID-19 here in Arkansas. As of yesterday, the death toll from the virus sits at 7 here in our state. Let's take a look at the other numbers. 508 people in the state have tested positive for COVID-19. 62 patients are in the hospital, 21 on ventilators. Again, 7 have died from the virus, the latest coming from a nursing home, and 32 patients have recovered so far. Here in Northwest Arkansas, 38 confirmed cases in Benton County, 18 in Washington. Crawford County has reported somewhere between 1 and 4 positive cases of COVID-19, and 6 cases are reported in Sebastian County. During Monday's briefing, Governor Hutchinson pledging more money to get resources to our frontline workers. He approved an additional $45 million for personal protective equipment, or PPE, as well as for ventilators. Previously, the state was allotting $30 million, but the governor believes that dollar amount will not be sufficient to get us through this crisis. The money will be coming out of the COVID-19 Rainy Day Fund created by Arkansas lawmakers in a special session. Healthcare facilities around the region making several changes to their hours, facilities, and non-urgent procedures, all to try and slow down the spread of this virus. In order to be tested for COVID-19, you must have a fever of 100.4 or higher, have respiratory symptoms like a cough or shortness of breath, recently traveled to a high-risk area, or have been in contact with a known COVID-19 patient. Across Arkansas, changes to state parks. Lodges have now been closed. Camping is limited to self-contained RV units only. And there's a new contactless check-in system for campers. Bathhouses are also closed, as are most visitor centers around the state. Meanwhile, state leaders want to remind you it is okay to get outside, but of course, keep your distance. Arkansas Department of Health Secretary Dr. Nate Smith reiterating the CDC's recommendation to limit groups of 10 or fewer. Now a directive is in state here in the natural state. The governor encouraging people to get out and about in nature, but says you need to keep at least 6 feet between you and others. Governor Asa Hutchinson now approaching the podium, so let's hear what he has to say today.
Good. Thank you for joining me today for the latest COVID-19 update. I'm delighted to be joined by Secretary Nate Smith, Secretary of Health, and then over to my left is Keisa Smith, who's the Deputy Director of the Department of Human Services, who'll give us a report a little bit later. And A.J. Gary is here, my Director of ADAM, who's working hard on procurement and supplies. Yesterday, we reported here that there were 473 cases of COVID-19 here in Arkansas, with 62 hospitalized. That number has gone up 50, and today it is at 523 cases of coronavirus, with 64 hospitalized. There's been 1 new death, and the total of deaths associated with this is now 8. We have 3 new counties that have been added as well: Columbia, Newton, and Perry County, and Dr. Smith will comment in more detail on those shortly. Yesterday I was asked a question about the New York Times story that we were on the bottom tier of states in terms of per capita testing. I actually had a chance to go look at that, and there were some numbers that were out of date. The story showed that 1,839 tests were done in Arkansas, and we have 5,794 tests that have been done in Arkansas. And so just wanted to make sure that was clear that our testing has accelerated in recent weeks. I did want to point out a graph that you have in front of you. I told you yesterday we're going to get back to our modeling, and as you can see from this, and this is what we presented earlier on the blue line, which shows that toward the end of mid-April, that goes to April 10th, we'll be at 3,500 cases here in Arkansas of COVID-19. And so I wanted to track where we are on the red line in reality. And so as you can see from here, we have actually lowered that trend line so that we are under it. The blue line where we were projected to be at 500 earlier than that. We are now at 500, but we're projected to be up close to 1,000. And so this is good news for us when you see, and the public needs to understand, that the red line means that we're having success in our social distancing. We're having success in following the guidelines that have been set of limitation on gatherings. And if we can continue to do that, then that blue line goes up. The red line, we hope to stay underneath that blue line. And this is a very conservative estimate, as most people know, in terms of our ultimate number of cases here in Arkansas. And this projection only goes to mid-April. We will try to extend this as we have more real-time information so we can project out further. But it gives the Arkansan really an objective almost. Let's do our part. Let's be self-disciplined. Let's follow the guidelines of CDC and Dr. Smith and the Arkansas Health Department. And if we're successful in doing that, we're going to beat what those projections are, and that's our objective, because that saves lives, that gets us out of this crisis much quicker, it gets it back to normality in a quicker fashion, and so that is the objective. As you can see, these numbers are based upon yesterday's number, and so today we're at 523 for the first time. We've crossed that line, and at 523 we're underneath the projection of what it was going to be, which was close to 900. And so with that, I asked the question, what more can we do as a state? And the immediate answer is be self-disciplined, to make sure that we follow the guidelines, that we limit our gatherings, that we have our social distancing. But then there's also something that I'm concerned about, and others have expressed it to me, and that is out-of-state visitors that are coming to Arkansas as a place that they can come, a place that they can enjoy our wonderful outdoors. They can, as we always have asked them to come here and enjoy our national parks and our state parks. But it has become a problem. I've received reports that there's a congregation of larger numbers of people along the Buffalo River and some of our state parks that are the most popular, and while you can practice social distancing there, it's not being followed sufficiently, and also the number of out-of-state travelers is creating the issue, because some of them are coming from hot spots that we want to be able to limit and restrict. And so as a result, I've directed my administration to look at ways to curtail the recreational traveler from out of state into Arkansas. It may involve some closing of our most frequently visited state parks. Again, this is not an Arkansas citizen who we want to be able to enjoy and practice social distancing. This is a comment about our out-of-state traveler from areas that are considered hot spots that might be coming to Arkansas, and we want to be able to limit that out-of-state traveler. With that, let me invite Dr. Nate Smith to come and to elaborate on some of these points and give some additional details.
Thank you, Governor. I'd like to first go over some of the numbers just to make sure we have all the details on that. As the Governor has stated, we do have 523 cases now, up 50 from yesterday, and we have the 3 new counties, Columbia, Newton, and Perry, so we have a total of 51 counties now. Of our 523 cases, 17 of those are children, less than the age of 18. 158 are older adults, 65 years and older. And then the 348 are aged 18 to 64. We do have a number who have comorbid conditions. Diabetes, 44, that's up 7 from yesterday. Heart disease, 39, up 3 from yesterday. Chronic lung disease, 23, up 1 from yesterday. Chronic kidney disease, 12, up 2 from yesterday. And 16 have immunocompromising conditions, and that's up 4 from yesterday. We have 79 of our 523 who are healthcare workers. That's up 6 from yesterday. Currently, we have 64 hospitalized. That's up 2 from yesterday. We still have 47 in nursing homes. That's unchanged. We have 23 who are currently on a ventilator, and that's up 2 from yesterday. As the governor has mentioned, we have 1 new death, and that's in an individual who's age 65 or older. We have 35 who have recovered, and that's up 6 from yesterday. There's a couple of issues that I wanted to briefly comment on. The first is our lab testing capability. We are working on that. It's very challenging because there's national shortages of reagents. We have had to go to a manual extraction process in our lab, which limits us somewhat, but we were able to do 94 tests in the Arkansas Department of Health Public Health Laboratory yesterday, and UAMS was able to do 83 in their lab. They've increased from less than 50 the day before. And going forward, we are going to be doing testing in our lab 24/7. We have the personnel trained to do that, and as long as we have reagents and supplies, we'll be able to increase and optimize our testing capability. The governor's already mentioned that article, and that they were using some older numbers, and we're in a different situation now. Wanted to mention that we are in the process of planning to build our surge capacity for hospitalized patients. We have National Guard assisting us with that. Their planners are working together with our staff and with other partners to come up with a plan for how we can increase hospital beds beyond what we have now to accommodate additional patients if we need those. And then also, finally, I wanted to talk a little bit about guidelines for when individuals can return to work if they've either tested positive or been exposed to someone who's tested positive, because there's a certain amount of confusion about that. I've gotten a number of questions from that. And I don't want to make it more confusing, but I think that if we can think of, first of all, the case where someone has tested positive, they're not all that sick, they go home and then they're feeling better. When can they go back to work? Well, if they've not been sick enough to go into the hospital, our guidelines for them, following the CDC guidelines, is that if they're 7 days past the onset of their illness and it's been at least 3 days since they've had a fever, then they're safe to return to work. Now, there are some situations, like healthcare workers taking care of high-risk patients, where they may have additional criteria. They may want them to stay out longer, but for most people, that's fine. 7 days after the onset of their illness and at least 3 days free of fever. Now, someone who's been exposed to someone who's a case, they've gone home as home quarantine, they don't have any symptoms, they are not tested because they don't have symptoms, and they're waiting around. How long do they have to wait? Well, they have to wait 14 days because that covers the incubation period. That's the period of time between when someone gets infected and when they first start to show signs or symptoms. Now, that seems strange. If you're a case, you only have to be out 7 days. If you're not a case and you've just been exposed to a case, it's 14. Well, it's a time issue here. The person who is a case, they've already gone through that incubation period, and we're just looking at the period of time between when they have symptoms and when they're no longer contagious. For the person who's been exposed to someone who's a case, we got to wait the whole incubation period. So we got to wait the whole 14 days because the problem is, if someone goes back after 7 days and then they become sick the next day, well, they've exposed a bunch of people there, and then they have to be quarantined. Before long, everyone in your work site will be quarantined. So you're not doing your colleagues a favor by coming back early. You may be actually creating more of a manpower shortage. anyhow, I want to close my remarks with that. We're going to put some graphics up on our website that help to explain that so that people can get a visual picture of what I'm talking about. So thank you.
Thank you, Dr. Smith. And in adding to his comments, I have signed the letter requesting Arkansas be declared a major disaster state as a result of COVID-19. We expect a very quick response from the federal government on that disaster request that I have submitted. In addition, as Dr. Smith indicated, we have National Guard that is assisting in the planning, and I have authorized 40 additional National Guard, Air, and Army personnel to assist in that effort. On the economic side of this crisis, as I've mentioned, we've had over 30,000 to-date unemployment claims. That's a little bit of an estimate. Our numbers come in through last Friday was 27,250 that we had in out by early next week because of the demand for those. I want to express my appreciation for those at AEDC and the Department of Commerce working so diligently on those. I also wanted to note that I have signed an executive order today at the request of the Arkansas Bar Association, the realtors, and the title companies, which suspends notary action in person. It allows, they can now be done in terms of notaries and wills through audio and visual means. This is for limited use by attorneys, notaries, for title companies, and those supervised by them or by banks. This will allow those that need a will that they haven't been prepared for to be able to get it done, even though they might be in isolation or they might not be able to, because of limitations on person-to-person contact, be able actually to execute the will or to get some transfer of property actually executed. And so just one of those consequences of limitation of social interaction, this is another thing that has to be done and remedied during this time of emergency. On the good news side of things, I'm delighted to have Keisa Smith here, again, Deputy Director at Human Services, that wants to talk about those that have been working from home in state government and doing extra assignments that benefits people, as well as some of the child welfare workers that we are doing some extra responsibilities under difficult circumstances during this time. Keisa?
Thank you, Governor. Good afternoon, all. I want to first start off by saying thank you to the Governor for all of his support and for equally allowing us the opportunity to quickly highlight some things that our staff are doing. As many of you know, we too have healthcare workers that are still ensuring that those in our care at the state hospital, the health center, and our human development centers across the state are getting the care that they need and are remaining safe. And we are extremely grateful for their continued work. However, we want to take a moment to recognize our staff that are making sure we continue to provide a safety net for those Arkansans that are most in need, and also those that have found themselves in need unexpectedly because of COVID-19. So in our Division of County Operations, staff continue to come to work, and some are equally working remotely, as the Governor noted. We have recently been given permission by the federal government to take SNAP applications by phone and waive interviews during this emergency, but there still has to be individuals processing those increases in applications. And also there are some staff that have to be present for those individuals that do not have a phone and internet access. But we have seen a great increase in the number of applications we receive, and so those individuals that are working remotely and at the office are seeing a considerable rise in the work that they do. Also, our Division of Children and Family Services, those staff are still keeping children safe across the state. Last week, I received a story about the fact that we had an allegation that came through from the Child Abuse Hotline that there was a 10-year-old that was being physically abused. The offender had put up several roadblocks to our staff, and our staff knew that they had to go into the home, and so they did that. Once they did that, they were able to get the child alone in the home, speak to him without the offender being present, and the child disclosed that he was being physically abused. That child is now safely with relatives, and they have told us that that child would not have disclosed if he was not spoken to face to face. And so that highlights the fact that there are still activities that our agency has to do that has to occur face to face, even in light of the things that are happening across the state. And not only are DCFS workers having to do that, but our adult protective service workers are equally going into homes during this pandemic and making sure that those Arkansans that are the most vulnerable, our children and our seniors, are being protected from harm. And our last story is something that we were able to share with the governor this morning. Our agency has started a new venture. We have about 15,000 clients that receive home health services. Many of these individuals are homebound, and unlike individuals that are in nursing homes or assisted care, they don't have someone that's coming in and seeing about them every day. And so we had some of our divisions come together and say that we really needed to find a way to check on those individuals and make sure that they were equally safe. And so they created a call center. Ad hoc got together and made sure that all 15,000 plus of those clients received at least 2 phone calls each week to make sure that they were not having any problems. And we were not running that call center very long before we made a call to an individual who said, oh, I'm okay, however, I'm low on food, and by the way, my power is off. What made that even more significant is that that individual was on oxygen, and not a portable oxygen machine, but an oxygen machine that had to be plugged in at night in order for her oxygen to continue to go. And so the individual that took that call immediately elevated it. You all know that we have offices across the state. We got a regional individual out to that home to make sure that the client was safe. We had another staff member call the client's children. The children made sure that they were going to get food to their mother. They also called the energy company to make sure that the power got back on that day, which it did. But our staff member that went out equally didn't stop there. She went next door and talked to the neighbor and let the neighbor know what was going on. And the neighbor even offered to pull out her extension cord and draw it to the next, to the house to make sure that that client got oxygen. And so it's just a story to show that even in the midst of trying times that we still have individuals that are working hard, Arkansans that are caring for other Arkansans and making sure that they are taken care of. And we are extremely grateful for all the work that they are doing and continue to do even in light of COVID-19 and what all is happening. Thank you, Governor.
Thank you, Keisha. Over 5,000 calls were made into people's homes to make sure they're okay. Very proud of that initiative and the difference it makes in people's lives. With that, be happy to take any questions.
Where exactly was that most recent death from?
The most recent death was also broadly in the central Arkansas region. That patient actually expired at White River Medical Center.
How can we be sure we are trending lower than the projections if our testing is so limited?
That's a problem across the country. As you probably read, we're not testing as much as we would like to, as much as we should. Now remember, these projections were made at a time when we had even lower capacity for testing. So this is not an exact model, but we actually are testing more than we were then. So there's a danger that we could overshoot our projection just because our testing capacity was so low in the first couple of weeks. But we've expanded that. We're continuing to get more and more lab test results from commercial labs, and so we've brought that up quite a bit.
How confident are you that we are below our projection?
Well, another way of looking at this, other than just cases, is hospitalizations. And as soon as we have a little bit more data, what we will do is go ahead and do projection lines for hospitalizations. Now, it's quite possible you could have someone out there who doesn't get tested, so they don't get counted. But once they're sick enough to go in the hospital, then we're pretty sure we're capturing them. So once we're able to use hospital data and make a trend projection based on hospitalized patients, then that will give us some confirmation of where we are.
Testing issue, are the positive numbers still being affected by the fact that you're doing a lot of tests at the nursing homes?
The ones at the Arkansas Department of Health Public Health Lab, yes. Again, we are prioritizing those because we've completed testing at the Briarwood facility, but we still have some work to do at the other nursing homes to complete testing of all residents and all workers. So that's also affecting our numbers. We have fewer positives than we might if we were testing a higher risk population. Now, this is a very high risk setting, so it makes sense for us to do that testing, but the ones that are coming in from the commercial labs have a somewhat higher positivity rate.
Excuse me, for cases, for counties that don't have any positive cases yet, do you attribute that maybe from a lack of testing? Maybe there are cases there.
Well, that's what I've said before, is that we have to assume that any public space is a potential area in which COVID-19 could be transmitted. And so I don't think we can say just because my county doesn't have any cases that it's perfectly safe, but we do know that it takes a while for this infection to spread throughout the state, and especially in rural areas where the population density is lower. There may be parts of our state that actually don't have any cases at all, whether we've done testing there or not.
How many results came back from those commercial labs? You mentioned the 90 plus from the Department of Health, the 80 plus from UMS. Do we have a number on that?
I'll go ahead and give you a detailed breakdown on that tomorrow. As the governor has mentioned, we had about 5,800 tests so far, and a little over 1,000 of those have been from the public health lab.
Do we know yet how many people who have recovered were on ventilators at one point?
We're working on that. I had that on my daily report, and a few days ago I said, look, no one seems to be interested in that, so we'll drop it off. Now they're having to come back and get those data for you, so I apologize. I thought I'd have them today.
The number of healthcare workers that continues to rise, are you concerned that some of those workers have been exposed because they don't have PPE, or is it all, what is it? What are the kinds of things going into that?
Well, I think we're doing a better job in general of getting PPE out. We're still getting reports of facilities that don't have access to PPE, but we've got personal protective equipment from the Strategic National Stockpile that's going out. We have a purchase that we've worked with UAMS to procure, and that will be going out soon. I don't think anyone has all that they anticipate they will need, but we're trying to get that out there. The highest risk settings for healthcare workers tend to be when a patient comes in and they don't initially suspect COVID-19, and then there are many people who were exposed before people think to put on the personal protective equipment. Our experience with the nursing homes and to some extent the hospitals is that once people know and are using the PPE, then the number of new healthcare workers who are infected drops significantly, but it's that initial admission when people don't know and they're not suspecting. So we have to have a higher index of suspicion.
So do you have a breakdown then of what sort of professionals they are? Doctors, nurses, respiratory therapists, medics?
I don't have a detailed breakdown of that today. I'll try and get that for you. Remember, this is a moving target, though. We're getting new reported every day, and getting all the details on it takes a little bit of time.
On the issue with the parks, it sounded, Governor, like you're considering closing some of the state parks, and then like with the Buffalo National National River, that's a federal park, so would you be asking the federal government to close that down?
We're in communication with the national park. I know that there's been a request from some of the local officials there in Newton County, and actually some of the concessionaires along the river have actually shut down out of a concern for all of the out-of-state visitors that are coming in. So we ought to work with the National Park Service. I expect some decisions to be made, but it's not just simply about the Buffalo National River. It's also about some of our highly trafficked state parks that are very popular, and whenever you look at the tags and they come in from other states and what we would consider hot spots, that's a concern. And whenever you see Texas starting to do more inspections of people coming from Louisiana into Texas, you know, are they going to be coming up this direction? It's a manpower resource as to the level of checking, but it's also, you don't want to totally impede commerce because, you know, we have vital goods and essential services that are being delivered. It might be a load of PPE that's coming to us via some of these routes. And so you want to make sure that commerce flows, and you want to make sure that across our state lines from Louisiana to Arkansas that the workers can go. We have a lot of workers that work back and forth across the states, and so you've got to really be careful about how you do this, and from my view, if you want to simply reduce the flow of out-of-state visitors, you're going to have to close some of the attractions that's bringing them here, because that not only they're not only outdoors, but they might be stopping somewhere along the line for gas. They might be on touch encounters, and so you know, it just increases the risk.
Looking at
It's living right here, Mike.
Are you looking at the potential of having like a checkpoint at the Louisiana line with state police?
I'm not considering that now. I think through a lot of different options, but I don't think that's the right step for now, and so that's not being done. You know, we've had the mayor of Helena that encouraged us to do inspections as people come across the bridge into Helena, and we've resisted that for some logical reasons, because once you do that, where do you stop? Because you got the Memphis Bridge, you've got you've got the bridge in Fort Smith, and so we don't have the resources to do that level of inspection, and it's not helpful whenever you're having that flow of workers going back and forth into our manufacturing and essential service.
People still not being able to get through. Phone lines are shutting down at 3. Anytime that someone has filled out anything through the website, they're being directed to either visit the office or call, and obviously they can't visit the offices right now. So what's being done to kind of hopefully streamline some of this?
Secretary Preston and the team at Commerce has worked very hard. I know that they've brought in 20 or 30 new staff people to be trained and to man the phones. I know that they've invested in new IT systems, and I know that they've tried to make sure that the website and the in-person opportunity is effective, even though we're trying to reduce those that go to the office. And so we've had tens of thousands that have got through and filled out claims. I know it's frustrating, but they're working on it every day. We're going to improve the system, but it's a challenge. But we've had over 30,000 that have successfully filled out their unemployment claims. We'll try to continue to accelerate that.
Any update on school closures? Are we any closer on making a decision?
Well, first of all, we're working hard. I talked to Secretary Key yesterday and today about how's the online education going. And so that's where the focus is right now, is continuing education today. And we're doing working with AETN. We're making sure that we get those online courses to even those people who don't have the high-speed internet that they need. So that's the focus now. We'll make another decision probably next week on where we need to be. Obviously, with the President's direction and where we see this going nationally, it's a question as to whether we can do Insight classes after April 17th, but we're not going to make that decision until later. We want education, though, most importantly, to continue regardless.
Is there anything being done more so at the rural level when it comes to broadband issues, things like that, to help them out?
Well, that's why we're going to that platform of public television, because even though they might not have internet, they usually have access to the television and public television, and that is a good remedy, and it's a good partnership with us. What we found is that down the Texarkana area, some are linked into Texas public television, and so we're working through that to make sure they have access. But this is the broadest platform available, and it covers that gap that Secretary Key has recognized exists out there in some of our rural areas for internet.
Have we gotten into any of the issues that the school system might deal with, whether it be holding back students potentially, even other things like such as the lottery scholarship, because grades are going to be a little different? Where are we at on some of that stuff?
I will wait for the right time, and I'm going to bring Secretary Key here that will address some of those questions more specifically.
On the major disaster declaration, what's the purpose of that, and what would that allow Arkansas to do?
Well, it's a little bit of a process you have to go through to document the losses, and so it is a very lengthy description of what we're facing here in Arkansas. Some of it is measured in terms of what National Guard resources are put into place, what it's costing the state, the extent of loss, the extent of cases that we have. And so we've reached the point that we could fairly document that, and we've worked with FEMA as they review it. I expect a very quick turnaround. Hopefully we'll have an announcement as to what difference that makes. That gives us, for example, access to federal funding for this disaster. The most clear example is our National Guard resources. Right now, when I allocate 40 more National Guard personnel, that's on the state's dime. But once we get a national declaration, then that moves it to Title 32 status, which means we get federally reimbursed for our National Guard expenses. So it's a very important step that we go through, and I have no doubt that that's going to happen. One last question.
The President's Task Force, Dr. Fauci's, they're going to release tonight their model for infection. Have they shared that with you?
No, they have not shared that. Maybe Dr. Smith has had a direct communication on it, but they're working at the national level on those. We see a lot of their same national models, and we review those. We compare that to where we are in Arkansas, but I really appreciate what Dr. Smith has done and his team at Health in trying to look and project where we are. And so we get information from the national models, but we want to tailor make it as to where we are exactly. And, if we get off course, we'll adjust accordingly, but I think that's more transparent and more helpful to Arkansans.
Is there anything being done for some of those hospital workers that are being furloughed? We're hearing from Baptist Health, the heart hospitals also, for just because, obviously the elective surgeries, things like that are being put off. Is there anything to do to either redirect them or to sort of reimburse?
Both appropriate concerns. First of all, from a financial standpoint, we want to make sure that they have access to not just our state unemployment dollars, but also the federal assistance that comes to them. We hope that'll come quickly. But then just as important, they're healthcare workers, and they want to be in the fight, and they want to be helpful. And so that's what Dr. Smith is referencing, that if we look at hospital beds, you got to look at personnel, you got to look at healthcare workers, and so we've got to develop a capacity to bring those volunteers in, not volunteers, but healthcare workers, and get them reallocated in the fight where we need them. Thank you all very much.
We just heard from Governor Asa Hutchinson and his staff on the daily briefing regarding COVID-19 and the spread of that virus here in Arkansas. Let's break down some of those numbers. A total of 523 cases have now been reported in the state. That's a jump from 50 more than what was reported at that briefing yesterday. 64 people are hospitalized, 23 on ventilators. 35 people have recovered. Out of the 523 cases, 79 are healthcare workers, 47 people are in nursing homes, and 35 people so far have recovered from COVID-19 here in Arkansas. The governor today also talking about the models that he talked about last week as well. The models showing a projected 3,500 cases by mid-April, 1,000 by this time. The governor pointing out that we've only met half of that number, surpassing 520 cases today. He says that is good news, and he's crediting social distancing and encouraging everyone to continue to be disciplined and only go out if you must. That means groceries, or if you really are sick and need to go to the doctor or get tested for COVID-19. The governor also encouraging people to stay indoors as much as possible, including state parks. One of his concerns is out-of-state travelers from hotspots coming to state and national parks here in Arkansas. He has directed his staff to come up with a plan to lower out-of-state travelers coming to those state parks, in particular the Buffalo National River. He says he doesn't have any plans right now to close any of them, but that could happen, and a plan is in the works now. The governor has also filed a major disaster declaration because of this outbreak, and he's waiting for the federal government's approval on that. Dr. Nate Smith today highlighting that the National Guard is helping come up with a plan to add hospital beds across the state. As you can imagine, the number of those available are dwindling as the spread of the coronavirus continues. So that's an important thing the National Guard is doing. When it comes to the economy of the state, the governor announcing 40,000 unemployment claims so far. He also said that 275 applications for business loans have been submitted for a total of $3 million, and he expects those to be funded here in the next week. He also signed an executive order suspending in-person notary action. It can be done now by phone call or by a video call. That's all to help with wills and to limit person-to-person contact. As far as schools go, he said that off-site instruction will continue, and as of now, the date to return back to school is April 17th. Our coverage will continue tonight on everything coronavirus. That's on KNWA News at 5, 6, and 10, as well as our sister station Fox 24 News at 5:30 and 9. Until then, you can find the latest updates on COVID-19 on our website, nwahomepage.com. You can also download our KNWA News app, You see it right there. It's free in the Google Play Store and the Apple App Store. Thanks so much for joining us for this KNWA News update, everyone. I'm Jennifer Piñate. Have a wonderful evening.